Dr. Kadlec, now you're recognized for 5 minutes.
Thank you, Chairwoman DeGette, Ranking Member Guthrie, and distinguished members of the subcommittee. Thank you for your continued commitment to flu preparedness and the opportunity to testify on our efforts to develop and rapidly manufacture effective medical countermeasures to treat influenza. As noted, influenza is a serious threat to human health and poses a significant national security risk. Annually, seasonal flu leads to hundreds of thousands of hospitalizations, tens of thousands of deaths, and costs $30 billion a year in lost productivity and healthcare costs. An influenza pandemic would be even worse, killing hundreds of thousands of Americans, costing up to $3.8 trillion. Mitigating both seasonal and pandemic influenza is critical to saving lives, protecting Americans, and reducing the economic and healthcare burdens that result. Before going further, I want to take a moment to thank you and your staff who worked on passing the Pandemic All-Hazard Preparedness and Advancing Innovation Act of 2019. It strengthens public health and readiness and healthcare readiness, bolsters response and recovery programs, and increases transparency. Specific and relevant to this hearing, it authorized an annual appropriation for pandemic influenza that will ultimately enhance the confidence of private partners to invest in research, development, and manufacturing activities. We also appreciate the past congressional supplemental appropriations for pandemic influenza preparedness. With the 2005, 6, and 2009 supplemental appropriations, we invested in new vaccines, antivirals, domestic manufacturing, and enhanced stockpiling. Continued effort and support and funding remains critical, however. ASPR's role in pandemic influenza preparedness is defined in multiple policy documents. The 2017 HHS Pandemic Influenza Plan outlines ASPR's initiatives to prevent, control, and mitigate the effects of the influenza virus to humans. More recently, in September of this year, the White House released an executive order on pandemic influenza preparedness. This EO identifies specific activities, many of which ASPR is already supporting with BARDA to strengthen preparedness efforts. Turning to preparedness initiatives, thanks to BARDA's investments, we've supported the development and approval of 23 influenza-related vaccines, antiviral drugs and devices, and diagnostics. Two significant items related to vaccine development is that now there is a licensed cell-based influenza vaccine that can be administered to individuals 4 years and older, and a licensed recombinant DNA influenza vaccine available for persons 18 and older. To enhance overall vaccine supply, we've supported development and licensure of adjuvanted influenza vaccines, and during a pandemic, using adjuvants increased not only the limited vaccine supplies to protect more people, but do so faster. To treat persons infected with influenza, we're also developing antiviral drugs. ASPR and BARDA has funded 9 novel antiviral advanced development projects since 2007. To better detect the emergence of influenza, we're supporting the development of in-home and wearable diagnostics to enable patients to take responsible actions towards earlier treatment to reduce the severity of the illness, and non-pharmaceutical approaches like staying home to prevent spread of the disease. While medical countermeasures will aid in the response and potentially limit the spread, there will be a strain on our healthcare infrastructure. Since 2002, investments administered through ASPR's Hospital Preparedness Program have improved individual healthcare entities' preparedness and have built a better coordinated system. Beginning in 2018, ASPR has supported regional partnerships to enhance capabilities above what exists at the local coalition level. The intended goal is to enable multiple healthcare systems to leverage assets and support one another when needed. The second issue that impacts response capabilities is our dependence on medical supplies, active pharmaceutical ingredients, and raw materials from overseas. When considering the global challenges of a pandemic, this dependence would become a matter of national security. ASPR is now incorporating new technologies to support innovation for preparedness and response. An example is alternative administration approaches such as microneedle patches that deliver vaccine through the skin that could limit our dependence on imported needles and syringes and allow for faster delivery and administration of vaccine. We'll continue to look for other innovative alternatives to address our reliance on foreign supplies. An influenza pandemic poses a significant threat to national security that could result in a significant loss of life, negatively impact the economy, and place a tremendous strain on our healthcare infrastructure. Continued support from Congress is critical to push the needle forward to best protect and respond to emerging threats. Thank you for your time, and I look forward to discussing how we can continue to work together on this important issue, and I'll be happy to answer any questions you may have.
Dr. Kadlec, what keeps you up at night when you think about preparedness for the next big flu outbreak?
Pardon me. Thank you, ma'am. I appreciate the question. I mean, I sleep like a baby. I wake up every 2 hours screaming.
Like me.
Yeah, but I think the key thing here is a pandemic. Quite frankly, I have the unique background on this committee or this dais to have served 2 years on the Senate Intelligence Committee and looked at the many threats that face the United States, but there is no singular threat that could devastate our country through our health and our economy and our social institutions than pandemic influenza.
Yeah.
And we had 4 during the last century, and even though we've had a mild one in this first century, I think the risk is that we'll have another severe one, and that would devastate our country. And I think very simply is the reason why domestic manufacturing is so critical, particularly for pandemics, is if there's a pandemic, everybody will be taking care of themselves. And so the fact if we're reliant on foreign suppliers for vaccines or anything else, we're likely to be at the end of that line because they're going to be taking care of that first.
Dr. Kadlec, I'd like to talk with you. Committee staff recently participated in a pan-flu tabletop exercise with ASPR, and thank you for that participation. One of the biggest takeaways was that the U.S. lacks sufficient domestic manufacturing capacity and/or raw materials for almost all pan-influenza medical countermeasures. This is very concerning. Further, that global manufacturing capacity would not be sufficient to meet the demand. So specifically, we have concerns about the United States supply of needles, syringes, surgical masks. That was raised during the exercise. We learned that, and I think we saw this during Ebola, surgical masks are not made in the United States, and so there was a run on masks and other supplies during Ebola. Can you discuss the challenges we face with respect to those supplies regarding the lack of domestic manufacturing and the volume we need versus what we currently have access to in the event of a pandemic?
Thank you, ma'am, for your question. And yes, it is a significant vulnerability as we look at, particularly for our pandemic preparedness. 80% of the materials that we're counting on for not only just for pandemic support, but generally in our healthcare system emanate from China and India. So that's both raw materials, finished products, and active pharmaceutical ingredients. If you had to look specifically at a couple of areas of particular concern around pandemic influenza preparedness, you would have to look at the antiviral drug supply. Again, we have about 67 million courses of about an 80 million person requirement that we have in our stockpile, and the active pharmaceutical ingredient comes from Asia at the present time. So once we would expend that immediate supply during a pandemic, in order to manufacture more, there are a number of generic manufacturers here domestically in the United States, but that active pharmaceutical ingredient would be found in Asia and would be a critical supply material for any country, much less us.
What are we doing as a federal government to work to address our domestic manufacturing capacity, whether for the API or
Ma'am, on the issues of vaccines alone, I think the key thing is I can't go into particulars, but we're going to have an announcement here shortly that will indicate some investments domestically to expand some of our newer technologies for vaccine manufacture. And I think the key thing there is that we're actively pursuing this in accordance with the executive order. Obviously, it's going to be a resource-limited kind of activity, but significantly beyond that, we're really trying to put our arms around this vulnerability in terms of our supply chain to the other things that you mentioned, surgical masks, latex gloves, other personal protective equipment, as well as active pharmaceutical ingredients.
Is it fair to say that if we're better prepared for seasonal flu preparedness, that would help us in the event of a pandemic?
Yes, ma'am.
And is the H7N9 flu strain still a potential pandemic threat? And you're all nodding yes, I suppose.